Hello, I'm Dr. Priyanka Reddy. I'm a fertility specialist from Motherhood Hospital's Fertility and IVF Department, HRBR layout, Bangalore. In this session, we are going to be talking about egg retrieval. So egg retrieval, or oocyte retrieval as we call it, means we are removing the eggs out of the body. Here basically we prepare the patient, counsel them, and injections are given for about 8 to 10 days, wherein the patient is given hormonal stimulations. Here we do scans at regular intervals. Serial scans are done to determine the right size of the follicle, and once the follicle is reached a particular size, we go ahead and give a trigger injection. And 35 hours after the trigger injection, we decide to retrieve the eggs out of the body. Here we ask the patient to come to the hospital on an empty stomach. The procedure lasts for about 10 to 15 minutes. Anesthesia is given to the patient, and under anesthesia, with the help of a transvaginal probe, ultrasound probe, a needle is placed and we retrieve the eggs out of the body. This retrieved eggs are sent to our lab, which is attached to the operation theatre. Egg retrieval process, as I said, is a very short process which involves only 10 to 15 minutes. It's comparatively a very safe procedure for the patients. It's done under anesthesia, that is where the patient is not going to have any pain. Also under ultrasound guidance, so we are able to clearly visualize the follicles. It's also a very short procedure, 10 to 15 minutes, so post anesthesia effects are also very low. All these are kept in mind, and the patient is first counselled regarding this process. She just needs to take off probably half day, so that it's a morning to evening procedure where she can go back home about 2 hours post the procedure. So the patient will be counselled regarding all these things much before in hand. Only risk that we see is something called as a hyperstimulation syndrome, which occurs in patients who have polycystic ovaries. If we do stimulate a patient with polycystic ovaries, we have certain measures to be taken so that we do not lead up or end up with a hyperstimulation. So once your eggs are retrieved, they are screened by an embryologist. So it's very important that you choose the right lab. The lab conditions are very important. The lifestyle recommendations that I would suggest would be diet, exercise, sleep routines, to follow no alcohol and no smoking. If you can inculcate yoga or meditation into your diet, in your system, and also bring down the stress levels.